This is Channel 4 on Wednesday. Now, diverse artists winning access to a sacred site.
Touch is the oldest way of giving comfort and healing. It is still part of the traditional craft of the barber's shop.
Comfort is very important. If one feels good, it has the physical and the mental effect of making the person generally feel good. And even going back to the ancient biblical times, laying of hands is part of the massage. And again, it becomes partly spiritual, partly the feeling of comfort, the feeling of being wanted, the feeling that you're being cradled. For a man, it gives him a feeling that he's back in his mother's womb. During the massage, one should be relaxed, and the fingers should make one relaxed. And there should be no conversations. The communion and the confessions start before or after, or at least after 2 treatments. And then you hear so many things that you shouldn't hear. You get a lot of satisfaction out of it, because to do a massage complete, to do it absolutely perfect, one should feel a wee bit exhausted after 35 minutes of applying one's whole being, one's whole hands, their shoulders, and even on their stance of their feet as they stand there. At the end, it should be a pleasant tiredness. It's good because you're transferring your own being through your fingers onto the person's face. If it is done in a mechanical manner, it doesn't matter 2 hoots. It has not the effect it's required of it. Unfortunately, it's a lost art.
In the 17th century, the barber and the surgeon were one and the same person, sharing the same craft guild. Today, they are the lowest and the highest of hands-on healers. Since nature was stretched on the rack of science to reveal the mechanisms of the human body, medicine has achieved miracles of healing. Science has discovered how to keep a premature baby alive, but to do this, it still has to isolate it in monitored and perspex sterility. Mrs. Lyle's baby was born 15 weeks early and immediately taken away and put into an incubator, an artificial womb. She reaches through the perspex barrier for a moment of contact, a simple touch that gives nurture to growth. Touching tells us that we're alive.
Smooth, good.
5-year-old Mark has been blind from birth.
You've missed a note. What does that feel like?
Soft.
It's soft. Is it furry as well?
He has to rely on and develop touch to understand shape and form. His hands and skin must become a sensitive tool, able to manage the world in which he will grow up and make a living.
Good boy. How many have you got so far?
1.
感受力中自在，有时候。
At a school for massage in Chengdu, blind students practice the Chinese art of massage. In China, people like the touch of the blind. They are valued both for their sensitivity of touch and the privacy they allow the patient in a culture that shuns contact in public life.
注意旋转那个动作。
旋转三体。
They follow a disciplined routine of daily exercises to strengthen their hands and develop this skill into a fine art. They practice massage, manipulation, and acupressure, a gentle vibration used on trigger points to affect the body's flow of energy.
预备，二拳捶，起。不要有弹性，接住的时间要短。加油！再加把油。 最后敲10下哈，1、2、3、4、5、6、7、8、9，停。
开始了吗？
开始了，就腿上放松，他那个就，他说
怎么做合适？
他是酒精中毒神经炎，
哎呀，好瘦。
喝酒喝的太多。 蹬腿外展，看到没有？
看到了。
蹬到最大限度的时候，猛给它外展，这个就是牵涉这个梨状肌。
哎，对，
懂不懂？
好，
再来一遍哈。
好。
蹬，蹬，蹬。好。对，好。
They adjust vertebrae under traction, the same technique as one recorded by Hippocrates in the 5th century BC.
魔法对元气，现在哈。
对的，好。
While the Chinese have for centuries had sophisticated techniques of massage and manipulation taught at schools and colleges, peasant Europe has had the traditional bone setter. One of the 4 best-known healers and bone setters practicing in Ireland is Danny O'Neill, an unpretentious cattle farmer. His reputation for curing and healing broken limbs, bad backs and dislocated joints draws both people and their animals to his surgery near Burris in the southwest of Ireland.
Pull that leg forward. Push straight up. Up. Yeah. And back now, right back. You walk your hand back and forward. Does it not know that shoulder? You better get the X-ray checked out.
The O'Neills of Burris have been bone setters for many generations. Patients from all over Ireland wait their turn for the brief 5 minutes in his surgery. Danny never studied a technique. He was born into a family tradition. His uncle had the O'Neill touch. When he died, people insisted that Danny had inherited the tradition. He bore the responsibility to look after his uncle's patients. When he first felt the dislocated wrist of a young girl, he realized that his fingers could see what was wrong and how to mend it.
This is it? Yeah, move forward. Keep your hands in the water. Just leg up in front of you. Up, right up, up. Up with it.
stoop a little 3 weeks. Don't stoop.
He applies the old family recipe, a poultice of resin, lard, burgundy pitch, bole almond and linseed oil. It sticks to the skin and must be left for 3 weeks and removed only if the irritation becomes unbearable.
I said, you can't cure me, I've arthritis, I have terrible pains in the back. Now at this stage I couldn't really walk anywhere. From here to the car was as much as I'd ever walked. And the pains, and you know, I'd given up the pernicious anemia injections at this stage because I felt I was losing my mind and I wasn't going to have that happen. And Dan says, take off your clothes. Well, I really thought he was a head case by this stage. And he says, go against the wall. And he says, you fought this out. Well, I didn't believe him, really. And in the thing, you see, it was from there up, I was telling him about the pains, but I never told him the pains down, you see. And as I walked out the door, it was like walking into a piece of heaven. For the first time, my head, the pain had left my head, the violent pain.
Leg right back behind you. That's it. Up again. That's it. Oh, you're right.
To reset this man's dislocated knee, Danny first gets someone else from the waiting room to hold the patient down.
Now walk up and down yourself then. Alright. Then back now as far as you can. Move back. Oh, Jesus. Right, then back. Back now, right back. Oh, Jesus. Christ, oh, we did you. Then back now, then back, then back. Right, say it. Oh, jeez. Walk it up and down now. Move it up and down. Oh, jeez. No, you're right. My God, I've had the pain. You want to stop a whiskey after that? My God.
Danny's methods are very old. Now, more sophisticated and gentle techniques have been developed.
Of all the diagnostic instruments that you learn to use in your 4 years of chiropractic training, the most important instrument is your hands. You have to develop the sense of touch and the ability to use these hands to a very high degree. So the finger pads can detect from the range of light touch to deep pressure, the tension of tissues. You can detect differences in, for instance, dryness of the skin or moisture. These are important diagnostic things to detect in patients. To feel, for instance, the vibration sense better in a patient, you can feel this better in this aspect of the fingers. The sense of temperature, feeling for whether an area is inflamed or not, can be detected better with the backs of the hands. And to detect differences in shape, for instance, when palpating out masses or lumps, the palm of the hand is the most effective area. But it does take a great deal of training, many years in fact. That's why you have to spend 4 full years working at it from the first year.
Chiropractic began in the Midwest of America at the turn of the century. At an old convent in Bournemouth, students now take a 4-year course at the Anglo-European College of Chiropractic.
Use your powers of observation. Note anything that's abnormal or different. Then take a general running down of the spine, feeling for temperature differentials, the state of the skin. Is it moist or dry, whatever. And if you find an area you think's a little warmer, double check it by using the back of the hand and compare it with other areas. And then go in feeling just below, sense with your hand, it's really an extension of your brain. They're sensing and feeling deeper and deeper into those tissues. So go down, feeling for this more superficial muscles. Are they relatively normal, springy tone, or are they more contracted or hypertonic? Or has there been tissue change where you can feel contractures or like a fibrotic, stringy feeling in the muscles? Once you're satisfied with that, move deeper and sense deeper. So you can concentrate your thinking in. It's a very perceptive sense that you have to develop with constant practice. You having difficulty there, feeling anything?
I'd like you to explain, if you could, exactly what I'm feeling, just this sort of inch out from the centre, whether this is an angle of the rib or whether that's the tip of the transverse process.
The transverse is coming to here, and if you palpate in deep, you'll feel a bony feeling of rising up there. That is the rib angle.
Oh, okay.
These, Rod, you can feel quite easily. The spinous process is there, but you have to palpate through quite a deep layer of muscle to appreciate the transverse process here. You can actually appreciate it when the patient's moving by asking to breathe, and you can actually feel the movements of the rib relative to the transverse far better.
Good, keep going. Oh, no, just hold on a moment there. That's the go. Now repeat that again, please.
It's tender where you've got.
Yes, a little bit tender on that left side there, up in that area, isn't it? It's a slight locking there. It's not very bad, but there's a little bit less motion on the left sacroiliac than on the right side. Now, I'd like you to rotate the head round and back over a little like that. Now, I'm going to compress down on the neck. If you feel any discomfort or strain or radiation of pins and needles or pain into the arm or shoulder, I want to know straight away. Okay? Right. Now, we'll just press down gently.
Yes, that hurts.
Where do you feel that hurt
That's
exactly?
Sending the pins and needles right through the top of my arm, this side of my arm, into the back of my hand and my thumb.
And the thumb?
Yes.
Okay. Does it increase any pain up in this region of the shoulder and neck? Do you feel that there too?
This muscle here.
Okay. And if I move the neck back to normal position, does that ease off?
That eases it, yes.
I see. Good, fine. Okay. What I'm feeling for is the opening and closing between each spinous process and the one above and below. See if they have a normal range of motion. Okay. You've lost quite a degree of motion or gliding action between these vertebrae, which form the joints of the cervical spine. And there was marked restriction when we took it in rotation that way at each level, particularly in these C6, C7, T1 levels. Now, it's held in this distortion pattern that I pointed out on the X-ray too, by muscle spasm. Because of the irritation of the joint, we get a reflex muscle spasms of the deeper muscles that run between each of these vertebrae. Well, this is the main area that I found restricted in the neck and where the most muscle tightness was. Now, I'd like you to understand the relationship between that area that you experienced in your neck and the nervous system or the nerve roots that run from those levels. Now, if you take particular note there, you'll note them running right down into the arm and going right down and supplying both thumb and fingers. And the compression you're getting at this level in your neck is creating that pins and needles feeling right down into the arm and hand, and is also responsible, it appears, for the pain pattern you're experiencing in your shoulder. Now, what I hope to do with you is to re-establish normal motion, if it's possible, by very gentle adjusting. It doesn't hurt. I'll set you up in position there and check each movement. If you feel the slightest strain or discomfort in any position I set you up in, I'd like to know. Okay? That feel okay?
Fine.
All right. That's the goal. Good. Just relax. Right, let's try and get this moving in here now. Okay. I'm just going to block from this side just to support the neck and come in on this level here. Okay, and just let the head relax in my hands. It's not going to hurt at all.
With a high-velocity thrust at a particular angle of the bone, he re-establishes normal motion in the fixated vertebra.
Is that quite comfy there? Okay. Just let the arms relax a bit. That's the goal. Good. Okay. Let me recheck and see if that's moving better.
The chiropractor sees the whole body as a finely balanced ecosystem. Any disturbance will propagate throughout the body. They concentrate on the spine as the support for the central nervous system. A bad spine affects the flow of nerve currents to any other part of the body. Sue Turner uses a similar yet subtly different technique. She is a registered osteopath. In diagnosing this case of lower back pain, the skilled hand and eye pick up fine postural imbalances that may have developed before birth from accident, illness, or muscular reaction to emotional stresses and strains.
It's still fixing there, isn't it?
Yes.
Okay. There's still a little twist down there. That's lovely. What I'm doing here is I'm increasing the flow of lymph through the body by creating a pump through your tissues. But I'm also looking at how free your fascia, your soft tissues and your joints are all the way through. This side, the movement is blocking a little at your left hip. So there's a juddering movement. It's not so free as on the other side.
Every cell of the body is maintained by fluids like the blood and lymph. The osteopaths believe that they can help these fluids to irrigate every tissue of the body to keep it healthy.
Just trying to release the heads of your ribs at the back and the muscles along the side of the spine. Come to a little tense area just here.
With the patient's body totally relaxed, she quietens the agitated nervous activity and the tensed up muscles that run along the spine.
That's all right, just relax and let me do it.
Like the chiropractor, a short, sharp movement at just the right angle frees the restriction that she diagnosed as causing his back pain.
Okay. Okay.
Yes. You got it.
Would you like to lie on your stomach and turn over to the other side? Let's keep my hands. Okay. Now I'm going to do the other side. Can you move back with your shoulders a little bit?
Yeah.
Okay. It didn't hurt, did it?
No.
Again, before the second thrust from the other side, the limbs are carefully positioned like a set of levers focusing tensions on the point of restriction.
I get tensions focused at that point. It goes easily. That's it. Okay. Nearly there. All right?
Yeah.
That wasn't too bad, was it?
No, that was very good.
Good. Can I just have you on your front so I can recheck that it's moving properly? On your front.
Front.
Sue Turner's next patient is 7-year-old Matthew.
He had a lot of ear infections between the age of 1 and 2, and already by the age of 4 there was a 30% hearing loss.
That's right, yes, that's true.
And this, I understand, is to do with all the mucus problems he's had in the eyes and nose and ears from very early on.
That's true.
Yes. Well, perhaps I could explain to you, Matthew, as well as your dad, because when you first came, see, this is a skull. That's what, if we took our hair and skin and everything off, that's what we'd see. You see that bone down there? That's called the temporal bone. And you see that hole in there? That's where the hole that you see when you look into your ear. And when you first came, I found that it felt very, very tight between this bone and the whole of the base of your head. And I know lots of people think that skull bones don't move, but the way I work, I think that they do move a little. You see that hole there?
Yeah.
That's where all the old blood that's been feeding the head and the brain and the ears and the eyes and everything, when it's been feeding all those things, then it comes out of there and it goes down your neck and it goes back to your heart. So it's very important that that hole there is feeling nice and free, so that you get nice new blood in and you get all the stuff you don't want draining out. Because when you get that movement, there's just a gentle pumping that's going on all the time from inside your own body, as if your own body is massaging you from the inside. And that's what keeps all the different bits of you healthy. And when you first came, it didn't have that nice pumping. For some reason, you'd got all tight round there. So that's what I've been working on, to try and get you to feel nice and loose all round that area. How's your tummy button feeling?
Okay.
Yeah? This is a bit lots of us get to feel very tense, don't we, when we get butterflies in our tummy. we get all tense around here. You're not tense. That's lovely and relaxed.
After releasing tension in the abdomen and relaxing the diaphragm, Matthew's whole body becomes freer and more open.
It's all right having the giggles. Just relax, Luce. That's it. Now, can you put your head straight? That's lovely. That's lovely. Seems to be more pulling into the right-hand side, the tissues on the base of the head, than the other way around.
It is a problem of unequal pressure.
Yes. The eustachian tube's not draining properly.
That's true.
Feel nice?
Yeah.
Or funny?
Funny.
Funny.
The trained hands of the cranial osteopaths can sense, they think, the tissues of the skull moving with the ebb and flow of the cerebrospinal fluid. To them, the healthy skull has a plastic, yielding quality, quite different to that of a sick person's.
Now all that pumping movement that's inside your body's gone very, very still. And that's a very good sign, because when that rhythm goes very still, it means your body's working very hard to readjust everything and make itself better. So I'm always very glad when I feel that.
The cerebrospinal fluid has a rhythmic pulsation, cushioning and nourishing the brain and nervous system. She feels that her hands respond to that pulse, still it, and release it into a dynamic balance with the body.
That's it. Now when you did that deep breath, and I did a deep breath just before, didn't I? Now the rhythm's coming back again. And now it's coming back after that still point. It's coming back stronger and freer. So a colleague of mine once said that when one's doing this sort of work, one can be talking to the patient and the patient's body and our hands are just getting on with it. And I see it in that way to a certain extent, but also at the same time I'm sort of visualizing what's happening within the body from what I know of anatomy and how that relates to what I'm feeling with my hands. If mind and hand really respond to the body's innate ability to heal itself, technique does go beyond technique to become spontaneous. It becomes creative.
The hands of the skilled masseurs can convey deep ease and comfort. At Charing Cross Hospital Cardiac Unit, this is used to calm the heart patient and show her that simple relaxation can bring down the blood pressure.
Patients will say, I remember her touch long after everything else. Nurses and mothers and people who are working in the helping professions do it all the time. We all do it all the time. When a mother reaches over and touches her child's head, when he's feverish, when we as nurses go in and touch someone just automatically like this, we are doing therapeutic touch.
Jean Sayre Adams, a nurse and healer from California, shows nurses that touch is in itself a therapy. She explains to directors of nursing studies at the John Radcliffe Hospital her belief in the ability of the healing hand to reach beyond and outside the barrier of the physical body.
Therapeutic touch is a method of laying on of the hands. It is not a miracle. It is an inherent human potential that all of us can develop and use. Put your hands together about a ½ inch apart from one another, the palms of your hands, and just become very, very, very much aware of what's happening between the palms of your hands. Experiment and bring your hands out a little ways, 2 or 3 inches, bring them back in. Pull them out a little bit further, 3 or 4 inches. Being acutely aware of what's happening between the palms of your hands. Whatever you're feeling between your hands, see how it changes, if it changes. Is everybody feeling something? What are you feeling?
Yes, I feel as if it's a magnet. One hand is a magnet and the other is a piece of metal attracting to the magnet.
When you assess the person with your hands and feel the energy fields and feel the differences in the energy fields, you're putting another piece of information about that person. You're getting in touch with another piece of them.
This technique of directing and manipulating energy at the same time as massage is part of the treatment of chronic pain and stress at the Lemuel Shattuck Hospital in Boston. For the practitioner, her hand becomes a tool, conveying complex messages to the patient about herself and her body. She thinks that her words help to put the patient into a deep relaxation and open her to a flow of healing.
Yeah, keep breathing through your feet, too. Let's hear a deep sigh. Keep breathing in and out through your feet. Yeah, that's good. We'll keep that contact.
I'm not washing my hands because they're dirty. I'm washing my hands because I carry conditions around with me. When I'm with a patient, I pick up their conditions. And unless I cleanse myself of that condition, I'm apt to go to the next patient and get the symptoms confused. So that's why I wash my hands. Don't get thinking it's because they're dirty. I had a good wash before you came. See, the beautiful thing about healing is that it's natural. Don't think it's something weird and wonderful.
Mm-hmm.
Everybody's a healer. You only got to think about the mother who cradles her youngster when he's ill or hurt. They get better. Right, well, I'm going to do the same as I did before.
Mm-hmm.
So I want you to relax.
Right.
Don't be afraid of really letting go. The more you relax, the better it is.
Mm-hmm.
That's good. And when you've really let go, my hands will start to change temperature. I should know that there's good work being done then. Promise I won't do anything without you knowing, so you can go to sleep without any problems if you want to. And when we've finished, I'll tell you what I've done. I should get up in a minute and wash my hands.
Mm-hmm.
Whatever you do, don't jump up. Just stay there and relax. There's a mild anesthetic effect when I'm working.
In Britain, there are more than 7,000 registered faith healers treating many thousands of sufferers. At his home in Bristol, Denis Barrett works with his hands on a patient troubled by scar tissue after 3 operations to remove stomach cancer.
I'm going to work the same way. I'm going to look with my hands to see what I can find. I already know that you've had discomfort around this area, the lower part of your abdomen. As soon as I put my hands on you there, they started to get warmer, which means to me that there's going to be some work done there, so probably take a few minutes. Might be 5, might be 10, I don't know. I shall have to stay here till my hands stop working, is the only way I can put it. It's ever so difficult to explain what happens. To me it's heat coming from my hand, but sometimes the patients say it's freezing cold. And I can only say that it's an energy, and the way it transmutes to the patient is according to the needs of the patient. Now underneath my hand, the right hand, I can feel things happening. And while they're pleasantly comfortable, it always seems to me when I'm working as if there's movement taking place inside of the patient. So I just tell you, so as you'll feel more comfortable and know what's happening. Nothing for you to wonder or worry about. I've never lost a patient yet. Well, that's good. Now we got some movement taking place there.
Explore every aspect of that hand. Notice how your partner receives your exploration of their hand. Do they seem to be letting you do it, or do you think they're trying to stop you from doing it? Now, if you feel that you know that hand well enough and that your partner knows you well enough, you might like to explore further up the arms, perhaps even to the face.
Linda has just been admitted to the National Health Adolescent Unit at Hill End Psychiatric Hospital. Her parents could not cope with her continuously running away and missing school. She had become unmanageable, and they were frightened for her safety.
Just notice what it's like for you touching your partner and being touched in that way. Keep your eyes closed. There are some of you who are working both of you at the same time, and some of you who are working just one partner touching and the other partner letting them feel. If you want to explore your other partner's hands and face, that's okay too.
The staff and patients hold action groups in the afternoon. At this one, touch therapy is used to try to affect and change their behavior. This psychiatric nurse works with Robert. Only the day before, he had to be physically restrained to contain his violent aggression.
Keep your eyes closed. Okay, you can stop now. What I'm going to do is I'm going to come and mix you up around the room, so I want you to keep your eyes shut.
After using touch to explore each other, the group leader separated them. Keeping their eyes tight shut and using their hands to feel, they had to recognize each other by touch and find their partner again.
Now I want you to, when you're ready, to open your eyes and to spend a few minutes telling your partner what that experience has been like.
Because I found it really easy to find out who you were again when I was going around the room. I felt quite safe actually. With sort of when we first were touching hands, I felt quite safe. Because you had quite a very strong, sort of, well, not aggressive, but, sort of warm hold.
Do you normally find touching easy?
I hated saying goodbye.
I don't touch my mum and dad's in it. I don't go for them for a cuddle or anything because I don't like it.
But you liked touching today?
My dad used to do it, and I used to fall asleep.
What about the touching was it that you liked?
And what else? And I felt like I was going to...
Can we hear some feedback on some of those experiences? What was the touching exercise like? Having your eyes closed, finding a partner. You look as though you're about to speak. You're about to speak?
At first she seemed, I suppose, a bit uneasy. She's sort of wondering who it is.
You were uneasy?
Yeah. And you start to get used to the feel of hands. And if it's sort of soft, warm, whatever.
I felt that my partner had given me something by allowing me to touch her. At one point she drew her hand away and I thought she wasn't going to let me touch it anymore. And that felt quite sad, but then she gave me her hand back.
What was it like for you?
It's all right.
What was all right about it?
The therapy of touch allows Linda to realize things about herself and tempts her to share them with the group.
Perhaps you could share with the group what you told me earlier.
Can't hear you?
Everybody just asked me if I would tell you what she told me earlier, which was that she was very happy and smiling when we opened our eyes after we'd found each other. And she said that she very much enjoyed the touching and that she wasn't able to touch her mother and father and that she never went to them for a cuddle. Was that right?
Okay, does everybody have somebody, at least one somebody in mind? Does anybody not have anybody? What I want you to do is to move to that person and sit back to back with them. Now, I want you to try, with your backs, to push your partner across the room, and as you're doing so, shout, yes. And B, try to push your partner back the other way, shouting no.
Yes, 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 yes,
No.
yes, 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 yes.
Okay, I want you to stop now. What were people saying yes to and what were people saying no to? Was it a nice feeling on your back?
No.
It was an unpleasant feeling, was it? So it was something not nice?
No.
Do you want to know what message I was trying to give you?
Yeah, if you want.
Well, do you want? I'll tell you. I'm willing to tell you if you want me to. Yes? I was trying to tell you to relax and to let some of the tension go away from your body, from your back, which felt very tense to me. I don't think I succeeded.
Can you tell us what you do want?
The shared emotion of touching draws the group in on itself. Touch confirms the reality of our world. It can rebuild order when chaos threatens. As barriers crystallize and crumble, all their hands home in on Linda.
This is a very hard place to be.
Go on. Don't know, yeah.
I'm glad to hear you say that. It's not a place to like.
I feel I'm sick.
You're all part of a group working for the same thing. You can all work together. They'll help you and you can help them. Everybody here wants to get out of here and go home. Just like you. Does that make sense? It's also true that all the adolescents here are here because they're giving somebody outside a break from their behaviour, and that their respective homes and parents want some change from them too, just like your parents want you to change. And that's where we have these groups, so that we can work on the difficult parts about changing. Because changing is difficult. Isn't it?
Science has made it possible to keep Mrs. Wogu's baby alive. Born too soon at 2 pounds 11 ounces, he would normally have to spend 2 months in the strange world of the incubator, isolated and deprived of touch and contact with his parents. But now, in an experiment at Hammersmith Hospital, premature babies are given the chance of getting closer to their parents. The nurses are encouraging mothers to make skin-to-skin contact with even the most fragile souls. The skin, the largest and most sensitive human organ, plays a vital role in both mother and child's development and well-being.
One. It's all right.
I came in here, I was shivering. I've never seen such a tiny baby in my life. I was crying throughout the night. In fact, the following day I was still crying. I was forced to touch him even when he was in the ventilator, when he couldn't breathe himself. They said I should carry him, that there's nothing wrong with my baby. I did for a short while. I carried him. In fact, immediately I carried my baby, I saw him smiling. I felt so satisfied, and ever since then, each time I come in here, I said they should bring him for me to carry the natural way, you know, for his skin to be next to mine. I feel satisfied. I feel that we communicate better.